Hi, I'm Dr. John, and I've been helping out people with autoimmune conditions for over 30 years, and more recently dealing with post-COVID viral syndrome as well. And it turns out that they're inextricably linked together. Let me show you the commonality. It's called NFkB. This stands for neural factor-kappa beta, which is the driving force in aging and cell death. The chemical name of it is called apoptosis. But what contributes to this inflammatory cycle? What is decreasing our health? Well, certainly the impact of metals from the environment, molds and yeast, traumas you may have had, various surgeries, current autoimmune conditions. Many of us have gut issues or diabetes, Hashimoto's, lupus, irritable bowel, anxieties, depressions, even fibromyalgia, Alzheimer's, and Parkinson's are all considered autoimmune problems, and they all tend to get exacerbated by this inflammatory cycle. In addition, a lot of us have put on a little unnecessary weight, fat called adipose tissue. That's highly inflammatory to the system, as well as the GMOs, the food coloring, the preservatives, the chemical residuals. But of course, the big one right now in everybody's mind is this virus, right? And the leftovers, what's happening with this? And it is all related to NFkB inflammation. This is what the cytokine storms drive. This is what depression drives. This is what bad food and inflammatory diets drive. So ultimately, this is what needs to be corrected. And the way to do that is we need to look at the autonomic nervous system. What that is you have the brain-gut connection. A lot of you have heard about that, but it's called the vagus nerve. And the brain sends signals to your guts and your metabolism glands, and they have a feedback loop that comes to the brain. And it's permanently disrupted with the cycle until you get it fixed properly. Now, how do we do that? How do you do that? Well, unfortunately, there's no one kit or one test that'll determine exactly what you need because we're all individual. So don't believe this one size fits all, I'm going to make a diagnosis for you. Does it make sense? Does it feel right that you need some customized program attacking this problem from all the various angles, looking at those parameters, having a discussion with you about your symptoms? So if this feels right, if this looks good to you, it makes sense, yeah, please schedule an appointment through an online form and we'll be in touch.